Hi everyone, I'm Melis, a CI user and advocate from Turkey. I was hoping to join you in person today to share my experiences, to listen to yours, and to meet the amazing people behind this event. But unfortunately, my visa was rejected. For me, it's about missing the chance to speak for hundreds of people back home who don't always have a voice. So I wanted to record a message for you because even if borders stop us from traveling, they should never stop us from being heard. In countries like Turkey, developing and maintaining CI services is extremely challenging. Life isn't easy for people with CIs, and support has to continue for life. But that lifelong support often comes with long waits, limited funding, and emotional strain. In Turkey, people must wait 7 years before they can replace their processor, and even then, they must pay the cost difference first before getting a refund. Imagine being a parent trying to explain to your child that they have to wait, not because the technology doesn't exist, but because the system isn't ready for them. Yet, despite everything, we try, and there are also some positive steps. Newborn hearing screening is now mandatory in Turkey, which means more children are diagnosed earlier and then they can access care faster. Also, Turkish public health system approves coverage for 2 implants, which is a wonderful step forward and something only a few countries have achieved so far. But it's still not enough. Many families continue to face long waiting times and limited support after surgery. Following these developments, our association reached an agreement with the state bank to offer loans for processor replacement. It may sound small, but for us it's huge. It's the only campaign we have for now, and I'm sure many others will follow. This kind of support changes lives, especially for children with additional disabilities who can't always protect or maintain their devices. For them, it means not only hearing again, but returning to school, playing with friends, and dreaming about the future. Our challenges don't end there. Unlike academics or public workers, advocates like me don't have green passports, so attending international events like this one requires months of paperwork, endless financial proof, and costs most volunteers simply can't afford. These are the barriers to representation. They mean fewer voices from countries like mine can be here with you today. When we talk about public health, we usually think of hospitals and treatments, but for CI users, public health also means communication access, being able to understand and to be understood in every healthcare setting. Too often, people with hearing loss face huge communication barriers. Medical staff may not know how to interact with CI users. Digital systems are rarely accessible. Even background noise can make communication impossible. These barriers can lead to misdiagnosis, misinformation, and fear. Accessibility in healthcare isn't optional. It's not a luxury. It's the human right. It's the foundation